Hi everybody, it's Rochelle, aka Shashu, with the Real Talk with Shashu. I'm sorry for keeping you guys in the limbo. I was out of town. I went to Dubai because I told myself right after graduation from nursing school I was gonna take the trip of my life. I was gonna have a good time after NCLEX, so I did just that. So I noticed a lot of you guys have questions regarding the program. So I answered some of the questions on my YouTube channel under the comments, but let's just do a thorough video. Number one, I noticed that a lot of people don't know that the generic and the transitional program has different learning outcomes and different syllabus. So I'm going to give you guys an example. I have few friends that went into generic, and I had few friends that went into transitional like me. Now, the generic program is for people that's coming right out of high school and going to the nursing program. Of course, they have to do the prerequisites. But the transitional program is people that have medical background experience, like a LPN, a paramedic, or a registered medical assistant, which I was before. The differences that I've noticed between generic and transitional program, from what my friends told me, is that, for instance, with transitional program, they're not going to start from the basic of nursing, like the basic foundation of how to do blood pressure, how to check glucose, how to what medication is what. They basically feel like you should already know these things if you're an LPN, or if you're a medical assistant, or if you're a paramedic. Now, however, the generic program, they're going to start from the bottom with you, okay? They're going to talk to you about how to check for vital signs, how to do the respiratory check, like, for instance, how to check for your pulse. You know, when you put the pulse, how you have to check the pulse with the two fingers, and then you put it about the brachial artery, which is on your ulna, the carpal area, blah, blah, blah. So they start from there. As a transitional, we went in, boom, boom, boom. They feel like you already know how to check pulse. So they're not going to go over with you, okay, how do you check pulse? Because as a medical assistant, as a registered medical assistant, as a LPN, as a paramedic, those things you should already know. So that's the big difference. Of course, with the, sorry guys, I have a cold. Of course, the books might be similar. I don't know, because my fundamental books were different. My med surg book was different from the generic program. Okay, so those are the two main thing that I want you guys to know. The generic, they look at you like you're fresh in the medical field. Some CNAs go into the program, other people, PCTs, of course, but they feel like you being a CNA and you being what's the other PCT, you probably don't know those things. I don't know. That's just my viewpoint, you know. Another key point I wanted to talk to you guys about, what you must know about Miami-Dade College, is that they're gonna tell you, oh, you have to buy the uniforms in the school. That's a lie. All my uniforms that I bought at Miami-Dade were blanched out. I mean, after I washed it one or two times, the color changed. Buy your uniform and make sure that it's the same color, okay? That's the biggest mistake I've done, because when I went to nursing program at Miami-Dade College, literally I was like, okay, they say you have to buy the uniform because it has the logo. I don't want to go in and they send me back, especially when you want to go to clinicals. You don't want to be sent back because of your school. Well, that's why they give you a name tag, you know? So that's the biggest mistake that I've did. I bought all my uniforms, which were way more expensive than if I was to buy it at those local stores. So please remember, you do not really have to buy your uniforms at Miami-Dade. However, make sure you buy your logos, get your logos so you can put it on your shirt. If you're going to the Miami-Dade Across on 20th Street, downtown Miami, the Blue Angels, I think, scrub store across from the street has the logos for Miami-Dade, so you can go that route. I hate my uniforms. I wish I can see, like, show you guys the uniforms. They short, and I'm only 5'2", and the legs were flooded. It was not a good material. The nursing bag. Do you really want to buy the nursing? Do you really need to buy the nursing bag? That I'm always, conflicted, because I think that it's better to be safe than sorry when it comes to the nursing bags, because, like, I had professors that would give us the stuffs in a school. Of course, we don't have it. They don't want to send you because you don't have the materials. But to be honest, I think it's best you buy the the nursing bag. They have a pen light on it. They have, when you're going to do trach care, they have on it. So regardless, just buy the nursing bag to be safe and sorry, because you don't want to go into clinicals and then the hospital saying, no, they can't give it to you. So just buy that, okay? Another thing, boom, what you must have for nursing school. Listen, this book, you must have it, okay? And when I say you must, it's a must for Miami-Dade. It's a must, okay? This is the book. It's called NCLEX RN Saunders Orange 8th edition. Now, do you need to buy it? Yeah, you need to buy it. This book was recommended by me, to me, from a friend who went to Miami-Dade, a real good friend. And on top of that, my first semester of nursing school, because I was in the transitional, we did fundamentals pharmacology in one semester. The professor was like, Rochelle, sorry. The professor was like, Rochelle, you need to buy Saunders because you know your content, but I don't think you know how to answer your questions but whatever, long story. So he recommended me the book. I bought it. I went from an average of 59, 62, 66% to an average of 80 to 90% on my exams with that book. Because this book, Saunders' book, it tells you the pathophysiology, the signs and symptoms, the nursing interventions. 3 things you need to know, not only for NCLEX, but for nursing school. The schools will test you on these 3 things: signs and symptoms, pathophysiology, nursing interventions. That's it. If you can go to nursing school knowing these 3 things, you're going to ace your exams. 3 things you must know: signs and symptoms, pathophysiology, nursing intervention. Now, pathophysiology means that what causes the disease, how does the disease transpire, what does it do to the body, what other organs does it affect. For instance, if you're going to talk about hyperthyroidism, it's in the pituitary gland, right? And you know what's near it. You know what the pituitary gland does. It flushes out calcium. It makes sure the calcium are in a good level, blah, 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 and so forth. Now, you need to know what's the signs and symptoms, okay? With hyperthyroidism, the person going to have exophthalmos, whatever, bulging eyes. They're going to be always hot, things like that, so that. And what is the nursing intervention? Well, you have to make sure that you put something over the patient's eyes so their eyes don't dry out. You have to make sure that you keep the room in a certain level, the AC in a certain level. You need to make sure that you need to make sure that they take their thyroid medication, their thyroxines. They take their Synthroids right on time, things like that. So once you know that, the teacher can ask you 10 questions on it. They can turn it around and say, oh, what's the signs and symptoms of hyperthyroidism? You already know what's the signs and symptoms. If they change the questions like, oh, this patient came in and they had bulging eyes, they were sweating profusely, the patient felt lightheaded, their blood pressure was high. What do you think that is? You already know the signs and symptoms, so you already know, hey, boom. If you have 4 options, if it says hypothyroidism, or it says hyperthyroidism, it says renal failure, or it says kidney disease. You already know that hyperthyroidism. That's the signs of it. So that's what I'm saying. Like, once you know those things, sis, you good. Sis and brother, y'all watching me, y'all good. Trust me. That's how I went through nursing school. That's how I went through NCLEX and all that. You have to know those 3 things. What I would recommend for nursing school, not only for Miami-Dade College, for every nursing school, y'all need to hit up Nurse Kathy Parks on YouTube. I bought her flashcards, and it was a lifesaver. Nurse Sarah is good, but to be honest with you, I'm gonna be honest with you guys, because I told you I'm gonna keep it raw and hard with you guys. I would not recommend Nurse Sarah if you have a attention deficit, like if you can't focus on something for so long. Me, I get lost. Once you start talking too much, I'm like, whatever. As you can see, my videos are very short. I'm not gonna make a video that's 30 minutes because people want to know what they need to know quick. They don't want to sit there and have to hear you talk for 30 minutes. Like, get to the point already, you know? And that's why I love Nurse Kathy Parks on YouTube. Look, go check her out. Like, she gets to the point. She said, hey, we're going to talk about Hirschsprung's disease. Boom. Hirschsprung disease, signs and symptoms. Boom. Pathophysiology. Boom. Nursing intervention. Boom. You're done. Keep it in your head. That's it. You know, Nurse Sarah, she has to go with like, look, I'm not a doctor. We're not trying to be a doctor here. Like, don't start with A through Z, because doctors gonna need to know the medication. Yeah, you need to know the medications with things, but doctors are supposed to know, okay, this, that. Like, I think she gives you the nursing aspect of it too in depth. Not trying to throw shade. So I'm saying, check out Nurse Kathy. You're gonna love it. Second thing, what you need to have. Like, remember I promised you guys that I would have PDF to share. Let me show you guys a little something with the PDFs. Okay, I brought everything. I brought the receipts today, honey. So I have a PDF. I'm gonna show you guys a little bit of the PDF that I have. So this PDF, I printed it out for somebody. Okay, it says, see, PDF. Y'all need it, call me, I got y'all. Now this PDF, it says, do not delegate what you can eat. They're gonna test you that heavy on nursing school because I don't know if you guys are familiar with Mark Clement, where it had the he has the audio of delegation prioritization. Well, this is a good PDF. I have PDF for days. So it says, do not delegate what you can eat. So that means as a nurse, registered nurse, if you're going for a registered nurse, not an LPN. And one point I want to touch with you guys, a lot of LPNs are confusing themselves when they're getting RN PDFs or when they're studying RN materials. Don't confuse yourself, sis, because this is going to be bad for you. Make sure what you're reading is for RN or LPN. I have LPN things too, okay? Hit me up. So there's like, for this for this PDF, there's another one that says transmission-based precautions, airborne. So, you know, my chicken has TB. So, you know, my means measles, chicken means chickenpox and varicella, has means herpes zoster, shingles, and TB. Things like that, like mnemonics, you know. And MTV is airborne, measles, TB, varicella. So things like that, okay? So hit me up for these PDFs, sis, okay? Inbox me on YouTube, and I'll send it to you guys. I have so many things to share with you guys. Like I said, I don't keep people long. I do not keep people long. So wait for me on my next video. I'm going to upload the next video. You guys need a PDF, let me know. I'm going to share all that I have with my YouTube subscribers. If you do not subscribe, I'm not sending you the PDF, sis, because I know for a fact you're going to pass nursing school with a flying color. Not because you're going to have the PDF that I'm going to give you guys to study, but because I know you got this far to be a nurse and you're going to pass it. You hear? You did not come this far doing research on YouTube and finding my page so that you can pass nursing school for you not to pass nursing school. I'm going to help you guys. My videos that I'm going to talk about next week, I'm going to tell you guys how to answer questions in nursing school. And y'all must know, nursing school questions are way harder than the NCLEX. I took the NCLEX one time. And I went there and I was like, Is this even an NCLEX? When I was in the middle of the test, I'm like, am I even testing on RN or LPN? Because this looks so damn easy. So the school exams, sis, are way worse. Okay? They way worse. The teachers are more confusing. ATI. Oh my God. Everybody's scared of ATI. ATI is doable. Okay? ATI teaches you, ATI tests you on your contents. NCLEX teaches you, test you on how do you apply your contents, how do you apply your knowledge, how do you as a nurse, when it comes to you and a patient in a room by yourself and a patient is having some symptoms, how will you react? Will you run out the room and call the next nurse, or will you know what to do? You know, if a pregnant woman just came out of labor and she has bulging fundus, will you know to massage it so it can be firm? Because when it's firm, that means it's contracted, then that means she would not be bleeding out. But if it's bulging and if it's saggy or soggy, that means she has a freaking slow, not slow, I'm sorry, it's not a word. What I was gonna say, it's not slow, guys, it's a certain word. Ugh, skip that. Anyways, y'all subscribe. I got y'all. I have a lot of things that I need to update y'all. See my MacBook? I have a MacBook. This one MacBook that I have, it's literally all the stuff from nursing school. Y'all need to check out Quizlet. But you know what? I'm going to tell y'all how to find the good stuff to study on Quizlet, because a lot of people upload Quizlet stuff to practice and it's not the right answers. Okay? I have a Quizlet channel that I have tests that I created to test myself. The Mark Clemic Blue Book is on my Quizlet. The Mark Clemic Yellow Book is on my Quizlet. All the subjects that I was tested on for nursing schools are on my Quizlet. So stay tuned. This is Rochelle, aka Shashu, with the Real Talking Shashu. See you soon, guys. Peace.